the complexity of senior healthcare. Welcome to this comprehensive guide on senior healthcare. As we age, maintaining health and independence becomes paramount, but it also requires careful navigation through medical recommendations. Routine health checkups are vital tools in early detection and prevention, but after 70, some common screenings and tests might no longer serve your best interests. In fact, they may do more harm than good. Understanding which tests are genuinely beneficial and which may pose risks is crucial. Overscreening, unnecessary interventions, and overdiagnosis can lead to anxiety, side effects, and even health complications. Our goal today is to shed light on 5 specific health checkups that older adults should consider avoiding, with explanations as to why and what safer alternatives exist. Each person's health journey is unique. It's essential to consult your healthcare provider to tailor your health routine to your individual needs. Remember, informed decisions lead to healthier aging. In the upcoming parts, we will delve into each of these 5 checkups, why they might be harmful after 70, and what better options you can pursue to stay healthy and active. We will also discuss how to work with your doctor to ensure your health plan aligns with your overall well-being. Stay with us as we explore these critical topics. We aim to empower you with knowledge so you can make confident choices for your health, comfort, and longevity. Your health is your most valuable asset. Let's protect it wisely. The overuse of bone density scans in seniors' bone health is a major concern as we age, especially in preventing fractures and osteoporosis. Many seniors are advised to undergo routine DXA scans to assess bone density. However, after 70, these scans may no longer be necessary unless specific risk factors are present. Why should you reconsider routine bone density testing? Because overdiagnosis is a real concern. Mild osteoporosis detected through scans often leads to medications with significant side effects, such as increased fracture risk, gastrointestinal issues, and rare but serious complications like atypical fractures and jaw osteonecrosis. Additionally, the radiation exposure from repeated scans accumulates over time, which can pose unnecessary risks. For many seniors, lifestyle modifications, adequate calcium and vitamin D intake, weight-bearing exercises, fall prevention strategies are more effective and safer ways to maintain bone health. If you have a history of fractures or other risk factors such as steroid use or family history, a bone density scan might be appropriate. Otherwise, focus on overall health, strength, and balance to prevent falls. Work closely with your healthcare provider to determine if a scan is necessary. Remember, the goal is to avoid unnecessary procedures that might cause harm and focus on holistic approaches to health. Routine PSA testing for men over 70. Prostate cancer screening through PSA prostate-specific antigen testing has been common for men over 50, but after age 70, routine PSA testing is increasingly discouraged. Why? Because many prostate cancers grow very slowly and may never cause symptoms or harm during a man's lifetime. Overdiagnosis can lead to unnecessary biopsies, surgeries, radiation, and other treatments with serious side effects: urinary incontinence, erectile dysfunction, and more. These risks often outweigh the potential benefits in men over 70, especially if they have other health issues or limited life expectancy. The U.S. Preventive Services Task Force recommends against routine PSA screening in men over 70 unless there's a compelling reason or family history. The focus should shift to maintaining overall health, managing existing conditions, and addressing bothersome urinary or other symptoms with your doctor. This personalized approach helps prevent unnecessary procedures, reduce anxiety, and preserve quality of life. Always discuss your individual risks and benefits with your healthcare provider. The risks of routine mammograms in older women. Breast cancer screening through mammograms has saved countless lives. But after age 70, the benefit of routine mammograms diminishes and the risks increase. Mammograms can detect tumors that are slow-growing and might never impact health, leading to overdiagnosis and overtreatment. Treatments like surgery, radiation, or chemotherapy can cause significant side effects, including fatigue, pain, and emotional distress. Moreover, false positives can lead to unnecessary biopsies and anxiety. For women over 70 with no significant family history or previous issues, many guidelines suggest that routine screening might be optional. Instead, focus on self-awareness, regular clinical exams, and discussing personal risk factors with your doctor. If you've had previous abnormal results, your doctor might recommend tailored screening plans. The key is individualized care, balancing benefits against potential harms. Colon cancer screening. When to reconsider colon cancer screening, such as colonoscopies, has been vital in catching early cancers and precancerous polyps. But after age 70, the decision to continue screening should be individualized. If you're healthy and have a life expectancy of more than 10 years, ongoing screening can be beneficial. However, for those with limited life expectancy, multiple health issues, or significant risks from the procedure, the benefits may be outweighed by the harms. Colonoscopy carries risks: bleeding, perforation, and adverse reactions to sedation. In older adults, these risks are higher, and complications can be serious. Discuss with your healthcare provider whether you should continue screening based on your overall health, personal and family history, and preferences. Sometimes, focusing on symptom awareness and healthy lifestyle choices is a better approach than routine screening. Routine chest X-rays. Are they necessary? Chest X-rays are common diagnostic tools used for respiratory issues, heart problems, and monitoring lung health. But routine chest X-rays, without specific symptoms or indications, are generally not recommended after age 70. Repeated exposure to radiation accumulates over time, increasing the risk of radiation-related harm. Moreover, incidental findings can lead to unnecessary anxiety, further testing, or invasive procedures that may not benefit the patient. Most lung conditions can be diagnosed through history taking, physical exams, and other less invasive tests. If you have symptoms like persistent cough, chest pain, or shortness of breath, a chest X-ray may be necessary. Otherwise, routine X-rays without clinical indication should be avoided. Always discuss with your healthcare provider whether imaging is truly needed for your specific situation. The dangers of unnecessary thyroid tests. Thyroid function tests are common, especially for those with symptoms of hypothyroidism or hyperthyroidism. However, routine screening in asymptomatic seniors may not be advisable after 70. Why? Because mild thyroid abnormalities are common with aging and may not cause symptoms or require treatment. Overdiagnosis can lead to unnecessary medication adjustments, side effects, and increased healthcare costs. In many cases, thyroid function should be tested only if symptoms such as fatigue, weight changes, or temperature intolerance are present. Overtesting can lead to unnecessary worrying and treatment. Work with your healthcare provider to decide if testing is necessary based on your health status and symptoms. This personalized approach prevents unnecessary interventions while ensuring care when truly needed. Imaging for asymptomatic heart disease. When to reconsider cardiac health is vital, but routine imaging such as echocardiograms or stress tests without symptoms isn't always beneficial for seniors over 70. These tests can lead to false positives, unnecessary procedures, and anxiety. In asymptomatic individuals, routine screening for heart disease often does not improve outcomes and can expose you to unnecessary risks. Instead, focus on managing risk factors, blood pressure, cholesterol, blood sugar, and lifestyle habits like diet and exercise. If you experience symptoms like chest pain, breathlessness, or fatigue, your doctor can guide appropriate testing. Otherwise, regular checkups and risk management are more effective and safer. Key risks of routine blood tests. Without symptoms, blood tests are fundamental tools for diagnosing numerous conditions, but routine testing without specific symptoms or indications can lead to overdiagnosis and unnecessary treatments. In seniors, overtesting may reveal benign abnormalities that do not require intervention, leading to unnecessary worrying and medication. For example, mildly abnormal liver or kidney function tests may be part of normal aging. Instead, blood tests should be guided by symptoms, medical history, and physical examination findings. Regular checkups with your healthcare provider help determine which tests are truly necessary to monitor your health. Personalized testing strategies help reduce unnecessary procedures, side effects, and healthcare costs, while focusing on what truly benefits your health and longevity. The overuse of cataract surgery and eye screenings. Eye health is a priority in aging, but routine cataract surgery or screenings without specific concerns may not be necessary after 70. Cataracts are common, but surgery is usually reserved for significant vision impairment affecting quality of life. Unnecessary surgery can lead to complications such. Similarly, routine eye screening without symptoms can lead to overdiagnosis of age-related macular degeneration or glaucoma, resulting in unnecessary treatments. Focus on regular eye exams, especially if you notice vision changes, and discuss with your ophthalmologist whether surgery or treatment is needed. Lifestyle choices, like wearing sunglasses and avoiding smoking, can also protect your eyes. The role of personalized healthcare and shared decision-making. As we've discussed, many standard checkups may no longer be appropriate after 70, especially without symptoms. The key is personalized care, working with your healthcare provider to tailor screenings to your health status, risks, and preferences. Shared decision-making is vital. Ask questions, understand the benefits and risks of each test, and consider your quality of life. Not every screening is necessary for everyone, and sometimes doing less can mean more. Focus on maintaining a healthy lifestyle, balanced diet, regular physical activity, social engagement, and managing chronic conditions. These are proven ways to promote longevity and well-being. Remember, your health journey is unique. Trust your healthcare team to guide you through appropriate, evidence-based choices that enhance your quality of life. Conclusion: smarter, safer aging. Thank you for joining us on this journey through senior health screenings. Remember, not all tests are beneficial at every age. Routine checkups should be tailored to your individual health, risks, and preferences. Avoid unnecessary procedures that may cause harm, and focus on holistic health strategies, balanced nutrition, physical activity, social connection, and regular medical consultations. By making informed choices, you can enjoy a healthier, more comfortable, and fulfilling life after 70. Always consult your healthcare provider to develop a personalized plan that aligns with your health goals. Stay proactive, stay informed, and embrace aging with confidence. Your health is your most valuable asset. Protect it wisely.